Hello everybody, how are you? This is Arifa, all the way from Toronto, and I always thank technology. We are linked globally, and I thank Dr. Anthony Leeds. He's always with us, and of course this segment is very important. It's for our health. And one of the subject what Dr. Anthony हमसे बातचीत करते रहे, that is about मोटापा, obesity. और ये obesity is a cause of many other problems. And today something else came up. I have two other wonderful doctors with me, and that is one of is Dr. Channa Jayasenna and Dr. Aditi Sharma. And of course, with the obesity, many other things are linked. And I was surprised today. We are going to talk about something which is a universal problem at the moment. All the plants, animals, they want to propagate their generation. And so is the human beings. We want our children. We want to continue our race. And this is a very important subject today. और मुझे यकीन है कि this subject is not only important for the young people, but this is important for the mothers and fathers. Reason being, how should we raise our children so that they should not face the same problem. Dr. Anthony, I welcome you to the show and thank you very much for being with us. You are a great researcher.
Thank you. So what we're going to talk about today is, following on from the previous episodes where we've discussed diabetes and other conditions that are related to obesity, we're going to touch on the question of fertility. And many individuals, I'm sure, are aware of the fact that globally there are problems with the levels of fertility. And I'm sure that some listeners have already become aware of the fact that overweight and obesity can have an impact on fertility. And we have with us two individuals who are based in London at Imperial College and the Hammersmith Hospital, with whom I've had the privilege of working over the last year or two. And towards the end of the programs, they will be telling us a little bit about the work that they're undertaking. But we're going to start by considering the issues generally, and perhaps begin with the question, the evidence from the literature and the epidemiology that the fertility among men across the globe is actually falling. Aditi, do you want to just begin by telling us a little bit to the background to this problem?
Thank you firstly for having us here today to talk about this very important topic. Very concerning that we have noticed, and studies have shown that fertility in men has declined, and there was a large study that was carried out within the last decade that looked at a decline in sperm count of more than 50% over the last 50 years. And we can postulate many reasons why that may be. And obviously some of it could be because of cultural shifts, use of contraception, couples choosing to have children later in life. But a lot of this could be put down to lifestyle choices. And as we said, motapa, so obesity. And what we have seen from studies is that there is a rising association between obesity and infertility, particularly in men. And there are studies that have looked at the fact that a rising BMI or body mass index is associated with a lower sperm count or lower fertility outcomes in men.
There are some other lifestyle variables, aren't there, that have an effect on male infertility as well, which obviously there is scope for change. Can you just comment on those as well?
Yeah, so obesity is one of the major risk factors, but there are other lifestyle choices. These include smoking, alcohol access, use of recreational drugs, and also use of illicit drugs such as testosterone or androgens, which can all impact the fertility of men.
Yeah, so we know that there are one or two things where advice can be given about diet and lifestyle, but my understanding is that nobody has really thoroughly investigated the question of how useful it would be to achieve good weight losses in men in fertility clinics. But can we just then go on to the question of within practice in fertility clinics in, for example, the United Kingdom, do we have an estimate for the proportion of problems that are associated with men as opposed to problems related to women? Because the focus in the past has always been on problems in the women rather than the men, and it's only recently that there's been a recognition of the importance of actually tackling problems in the men as well.
Correct. And as you've very correctly pointed out, most of the focus on research so far has been on looking at female factors. And the more and more the recent research looking at factors affecting male fertility, it's nearly 50%. So 50% of cases of couples that are finding it difficult to conceive are secondary to male factor reasons, so a poor sperm quality in the male partner. And the global estimates, taking into account, the statistic from epidemiological studies, nearly 1 in 7 couples, which is 15% of couples, are thought to be infertile. And obviously that varies depending on different regions. So there are parts of Europe which have higher percentage compared to that. There are parts of Africa that have even higher prevalence of this. And it's taking into also understanding that there are quite a lot of limitations to this statistic, because there are areas around the world that have stigma attached to reporting male infertility. And also cultural barriers to reporting that, so it may even be higher than this statistic.
Can I ask one question here, Dr. Anthony, please, if you don't mind? Dr. Sharma, you gave a wonderful information that this infertility is increased 50% as per your information. And of course, many factors what you told, and you also mentioned, do you understand Urdu as well?
Yes, I do.
Mera dil chahta hai ki if I can, Dr. Anthony, if you don't mind, can I ask that in Urdu?
Yes, please do. Yes.
हमारे यहाँ बहुत बड़ी प्रॉब्लम है कि most of the families में they end up in divorce, because normally it is considered कि अगर बच्चे नहीं हैं तो that is because of a woman, one thing. और अगर बहुत ज़्यादा बेटियां पैदा होती हैं, that is also because of the woman, and then that ends up in divorce. So I am surprised कि आपने जैसे कहा कि मर्दों में infertility ज़्यादा reason है. What is the reason? How people don't find, and what should they do to find out that who is responsible and what is the cause of infertility, like not having children in the family? What should people do different?
Yeah, so I think culturally and traditionally or historically, and maybe more prevalent in some of the cultures, whether that's Asian culture or parts of African cultures, where rightly what you've said, it ends up being the female is the one who's first investigated for, causes of infertility. So if a couple is struggling to conceive. And there is that cultural barrier where, it's about masculinity, where, if there is any issues, then in certain cultures, again, as you've very, pointed out, that there is the option of divorce or option of multiple partners to lead to a successful conception. But studies are showing, and I think it's important, and I think it's good that we're talking about it, and I think awareness is the first step to everything, and being aware that there is there are female factors, but there are also male factors that contribute to infertility. And you talk about what would be the first step of investigating it. I think it's investigating the couple together. So looking at female factors, so looking at things like, menstrual regularity, looking at the anatomy of the uterus, etc. But at the same time, more for male fertility, looking at the men's semen analysis, examining history, looking at lifestyle factors as we're talking today, looking at anything that can be modified to improve the chances of the couple having a child.
Thank you very much. And Dr. Anthony, I'm sorry, I will definitely get,
Yes.
and because this program is for the benefit of the families,
absolutely.
would say that it's not only one community, South Asian community, as Dr. Sharma said, that in African community as well, it's a male dominant. And I would say even in North America, Americans and Canadians, men are dominant in one way or the other. But in our community, sometimes mothers, they are not, and this program is to educate, as I said in the beginning, कि माओं को और बाप को भी educate करना है कि अगर आपके बच्चे हैं तो there might be a problem in the son. तो कहने का मकसद ये है कि normally Dr. Sharma, in our families, the mother is not ready to accept that, the problem, my son might have a problem. So, because they don't want to associate this stigma with their son. So this means if there is an infertility, you must pay attention to your son's life as well. And आप अपने बेटे का भी test जरूर करवाइएगा. Yes, please, Dr. Anthony, go ahead.
The comment I was going to make was that, of course, globally what we're seeing is a rising prevalence of obesity. And while we don't yet have the experimental evidence for large weight losses in relation to the effect it will have on improving fertility, this will come in the fullness of time. But in parts of the world where the obesity rates are much higher than they are here, for example, in the United Kingdom, so I'm thinking of some countries in the Middle East, I think there's probably a tremendous problem. We know there is a problem, but it's perhaps unaddressed, a real problem with male infertility. And one of the questions I was just about to ask is, there is patchy provision of fertility services, and clearly if we're faced with a global increase in obesity rates and a global increase in infertility, then the response has to be the provision of specialist services where it's possible to do so, because Aditi, there's a long protocol that one has to go through in asking all the questions and addressing all the different issues under the different headings, and then of course having to go through various treatments to see what is the appropriate thing to do. So in relation to, I'm really just saying that, we have a real problem. There's insufficient provision of fertility services as far as I can see. Is that true?
Yeah, so it's obviously very variable depending on which part of the world we're at. So depending on the healthcare economy, depending on the availability of assisted reproduction technology, depending on education, being aware, couples, that there is that option of assisted reproduction. All of those factors do affect, and obviously in certain parts of the healthcare economy, it's funded by the state. So for example, in the UK, we've got the National Health Service, whilst in other parts of the world, it's more via, private funding or via insurers. So all of that does impact the provision of fertility services. And I don't know if Channa would like to add anything more to that.
Yes, thanks, Aditi. No, it's a really interesting question, Tony. I think that the arrangement of fertility services at the moment has a few problems. One of them is that it's very expensive to do IVF treatment, which is the most common fertility treatment, where the woman gets injections to collect eggs, and those eggs are fertilized in a lab and then put back into the woman. And I think the problem is now in the UK, most IVF is done because the man has poor sperm quality. So it's akin to finding out your car is not working properly and getting a taxi. So in other words, because IVF has been so efficient, the taxi has been so good, we've never really had to stop and think, maybe we should fix the car. And it's only now that the costs of IVF are burdening governments and people so much that I think certainly in the UK, but in many countries, people are looking at alternatives. And so this limitation of funding excludes many people in the population in many countries, sometimes all countries. But what's heartening is perhaps if we can find ways of treating husbands, sons, etc., we can act. It may be more cost effective for states, but also for people themselves.
Yep.
Dr. Channa, I have a question of you. Do you mind if I can ask that?
Please
I
do,
understand we are talking about IVF, and that is the last thing. But the quality of life from the childhood to the till they get married. What about as Dr. Anthony said about the obesity? So the obesity in the younghood, that contribute towards my one question. And the second question is the dress up, especially for the men, wearing tight pants, tight these shorts. Does it also affect their quality of producing these good kind of sperms later on in their life?
No, thank you. Those are two very good questions. In answer to the first one, I think it's common in the Asian community, certainly from my own personal experience, that your mother and father will want to feed you as much as possible. And there is good reason and cultural reasons behind that. But I think now it kind of counts against us, because I think if you overfeed children and you have obesity when you're young, you're at much higher chance of having obesity when you're in your 30s and 40s, and maybe your appetite and your conditions for having obesity are altered. So I think it's absolutely a risk, because I know from my own family, I think ever since I've left home, my mother's thought I've lost weight, and that's because she's attuned to thinking that sons should be fed and fed well. And outside of starvation and in a Western diets, then unfortunately that counts against us. And one of the key ways for people to understand at home is that this may prevent you from having grandkids, that actually it's in your interest that your sons aren't obese, that they are actually healthy and exercising, which is, I think, a cultural shift for everyone, particularly in the Asian community, I would say. In answer to your question about the tight-fitting pants and trousers, just like having a hot bath or cycling for long periods of time, anything that heats up the groin area too much can reduce sperm count and quality by a little bit temporarily. So it's not going to cause lasting damage, but certainly when couples are trying to have a baby, it makes sense to wear looser underwear, not wear tighter clothes, and not to go for very long cycles for 1 or 2 hours. Going cycling for a short period of time is fine, and also not taking very long hot baths. So this tends to be something that couples who want to have a children in fertility clinics are told very quickly.
Very nice. So this means क्या कमाल की बात पता चली कि लड़के ज़्यादा लंबा हॉट बाथ अगर लेते हैं, that also affects reproductive activity in the boys, number one. Number two, ये जो tights पहनना है, that also affects the fertility in the long run. But at the growing age, when they wear, for example, the youth, young boys, they want to wear the dress according what the fashion is, and they wear very tight pants, and it's a growing period of their testes and everything. Does that affect later on in their life?
Channa?
I don't think that is the case.
Okay.
I don't think there's any long-lasting damage, but in the short term, it's not ideal for fertility. So I would say the most important thing is to encourage your teenage and young boys in their 20s and 30s to be healthy. A healthier man will make healthier sperm and better chance for grandchildren.
Yes.
So this means having a right kind of food जो आपको मोटा ना करे, वो the fatness and the obesity will cause diabetes, heart condition, and of course the one of the main area is it can cause or it may cause infertility. My last question to you, Dr. Channa, is, as we are talking about, you did talk about the hot bath के लड़के जो ज़्यादा लंबा hot गर्म पानी के बीच में रहते हैं, that affects their fertility. What about the latest technology and driving the cars with the hot seats,
Yes.
turning on the heat in the car seats?
And that's something you'd be more likely to do in Canada than the United Kingdom, especially in the winter, isn't it?
It's very
Yes.
no, it's very common
Yes.
in Canada, and I believe
Yes.
in India and Pakistan now. There are people who can afford all the latest cars with all the luxuries, and people think that it's one of the best luxury that in the winter they put on
Yeah.
their heated seats.
Yes. Can I just ask a related question there to Aditi and Channa? Do you know of any paper which has looked at the question of the use of these seats? Because they can become very hot, actually, in my very limited experience of heated
But
seats.
it's a continuously, if they are using continuously,
Yes.
driving
Yes.
3 hours and using it continuously. Yes,
Yeah.
Dr. Channa.
I certainly don't know of any research on that. I think more broadly, I think trying to, whenever possible, I know it can be difficult, certainly in parts of Canada when it's so cold, is trying to get out and exercise is doubly effective. So I think people who will be spending long periods of time in the cars may live what we call sedentary. That means lives, office jobs, where you're not really using your body and exercising and taking your heart rate up. So it's more a picture of not sitting down for too long and trying to encourage exercise on a healthy diet. It's possible that having a heated seat may be not good for your sperm count as well, but we don't have direct evidence of that.
Thank you very much. Yes, Dr. Anthony.
So just before we come to the end of this segment, could we just comment on the question of weight reduction? Because you ran through a whole set of issues relating to lifestyle and also the problem that there's limited funding for IVF cycles. And I think in the United Kingdom it's still the case that the NHS only pays for one cycle, and then after that it has to be paid for privately, I think. I'm not sure. It may be the same in other countries. Do you think that there is scope for a more aggressive approach to weight management?
Yeah, there is. I think we're more aware, and I think by talking about this, that as we earlier said, that it's mainly been focused on female obesity, and part of preconception counselling has been aimed at weight loss in the female partner. So I think, yes, I think being aware that obesity is a risk factor, adverse lifestyle factors that we've named before are all contributory. And yes, there are other things that we're not aware of yet, such as, heated seats, or, other things that increase heat or scrotal temperatures, so which could all be contributing. So there is scope for improvement in provision of obesity treatment. And I think one of the things that have come through with the COVID pandemic, for example, because, studies have shown that obesity is a major risk factor for COVID and, the mortality and the morbidity with COVID, that has also shown that, there is more that can be done to deal with the obesity epidemic, and that we haven't been doing enough. And that whether that's with lifestyle changes, physical activity, and other measures of weight loss individualized to the person.
Yeah. Channa, you wanted to make a comment?
Yeah, no, just I agree entirely with what Aditi says. Just to add something, a different perspective. I think long ago, many years ago, it was more common for couples, maybe in urban environments, to have babies when they're in their 20s or even teens. Now, in many countries all over the world, I think, because of the increased education of women and women working and having careers, it's more common for couples to have children in their 30s and sometimes pushing 40. So when you're 20 years old or a teenager, I just don't think it matters so much what your weight is and your lifestyle, because you're so young, your fertility is so high, you can overcome that most of the time. But in the here and now, in the 21st century, with people having busy lives and other things to be doing, when you're in your 30s and maybe even 40s, I think it's absolutely critical that you do everything you can to get ready for parenthood and to lose weight. And I think that should be very aggressive, because I think even for the state to fund that, I think it will save money, it will make people live longer, and it will lessen the need for fertility services, which are very expensive.
Yeah. And
Very
it's
nice
very important
information.
also for people not to wait too long, because in the bariatric service within which I worked, I've seen women in the late 40s really leaving the whole process of the weight loss until it was almost becoming too late to be helpful, which is unfortunate.
Yeah. I tend to say to my patients who have already seen me in clinic, tell me when you want to, give me 2 years notice. Give us 2 years notice. Get 2 years ready, 2 years to get ready to become a parent. If you're obese, or if you're smoking, or if you have enough, or if you have too much alcohol intake, you need that length of time for your body to correct itself and to straighten out.
And I think that's a very important message that probably is rarely understood or even known about outside, isn't it? It's some information that we really ought to be disseminating more widely.
So it's a very good information. So this means if you want to have grandchildren, start from the beginning. And अगर आपके बच्चे हैं, तो you should look after them, the right ones. They are teenagers and they are very young. उनके वज़न को लाजमी तौर पे देखिएगा. And if you are married, don't wait too long. और पहले बच्चे पैदा कर लें, उसके बाद तरक्की कीजिएगा. The third thing which is very important, Dr. Channa said, is बच्चों की जल्दी शादी कर दें. Because when you are young, you can produce good sperms, good quality eggs, and you can have intelligent children. Thank you very kindly, Dr. Aditi Sharma, Dr. Channa, and finally, one of the best, Dr. Anthony. Thank you very much. So all of you have some assistants working in the labs. Is that true? You have assistants?
Oh, yes.
Okay. We do.
Yes.
Exactly. I am told, and I know that sometimes assistants are half doctors, although Neem Hakeem Khatrai Jan, but assistant. So I'm very happy. I'm very lucky that I'm with 3 great doctors. So I can say I am 1/4 doctor. Is that right?
I'm sure it is. Yes.
Thank you very much. Thank you very much, everybody. Please stay tuned. We are going to continue this segment in next episode. Stay blessed, stay safe, stay happy. Don't forget these tips by these great doctors. We are lucky to have them with us. Thank you, doctors. We'll see you in next episode.
Thank you.
God bless.
Thank you.